This afternoon we're going to be restoring tooth number 18, which has looks like some relatively small decay that did show up in the hygiene appointment with the red dye. This is a relatively new patient with us, and one of the things that we have done in our practice is to use caries indicating dye at the hygiene appointments to be able to evaluate when there's decay. You could see a minute ago a little bit of the dye on the buccal. We're going to use a Hoya VersaWave erbium laser to help us do this restoration today. We have given no anesthesia. In this particular instance, you can see the light that is coming from the end of the laser, which is not actually the laser beam, but it is a directional light that comes out of the laser itself to help you be able to see where you're going a little bit better. That's the only purpose of that particular light. In this instance, one of the reasons we really like to use the erbium laser on restoring teeth is that in many instances we can restore teeth like this one without any use of any anesthesia. As you can see, this restoration looks like it's starting to get a little bit deep pretty quickly, and we were not really expecting this to be very deep in this particular instance. One of the advantages of the laser, besides being able to do things without anesthesia, is that it will literally sterilize any area that it is touching. And so when you get through with the preparation portion of your restoration, you now have a completely sterile area to then bond back your restorative material to. And in this instance, you can see where we're using the laser to clean out the decay, and there appears to be a fair amount of decay there on the buccal that you can see. As we are restoring these teeth and doing the preparations, we continue to use the red caries indicating dye to show us where the decay is and how much decay we still need to remove. And you can see there on that tooth there is some decay there on the buccal, and with the Explorer I've got a pretty good little stick there, which concerns me about how deep this restoration may be. You can see a little bit in the mirror that doesn't really look too bad on the occlusal at this point, however. Another great advantage of using the laser is that it will anesthetize the tooth. It doesn't do it 100% of the time, but many times you can anesthetize a tooth adequately enough to be able to use a high-speed handpiece to give yourself better access. And what I'm doing in this particular instance is mainly using the high-speed handpiece to give myself a little bit better access now that I see that I'm going to have a little bit deeper decay in this restoration. And that's really the only purpose of the high-speed handpiece here in this particular instance. We'll be coming back with the laser in a minute to complete the excavation process with this tooth. And here you can see now in that mesial portion of that one that there's a pretty good bit of decay evident underneath where it appeared that we had a small restoration coming. And now you can see where we really got a lot of decay down inside this tooth. And using the Explorer as well, it is definitely soft in between there. So now we're going to come back and we're going to use the laser again to help us clean out the rest of that decay. One of the great advantages of the laser over air abrasion is that it has a greater affinity to relatively soft decay, where the air abrasion just sort of hits the softer decay and catches and just is stopped there. Where with the laser, it has a greater affinity to the water that's in the decay. And so it'll remove that decay that's a deeper decay really pretty fast. beginning to see, this is a pretty good size restoration that we are going to have now on this tooth. And if you think about this, we have no anesthesia on board, which is really pretty good size restoration. Check myself with the Explorer, and then come back to complete the excavation process with the erbium laser. That pointing beam really does a very nice job of helping you be able to have a little bit better visual access as you get into these restorations and you're cleaning that out. Now we have got all of the tooth excavated completely, and it's time to start thinking about restoring the tooth. The way we're going to do this is we're going to use our acid etch inside the tooth initially, and then we will rinse that out. We do already have the tooth etched from the laser, but at this point in time we're still using and counting on the acid etch technique to assist us in creating better bond strengths in these restorations. There are some people that talk about that you may not need to do that, but today we're still using the acid etch technique. Now that we've got the tooth isolated and we've got everything cleaned out around in that, now we're going to apply our bonding agent. The bonding agent that we happen to use and happen to like the most is Primabond NT. It has an A and B component. This time we're just using the A component, which requires being set with light. Now that we have that in there, this will be a little bit different technique because we're going to go straight in with our flowable composite right directly on top of our uncured resin. And because the laser a lot of times creates little nooks and crannies down inside, we'll use the Explorer to help make sure we've got all that down in there real well, and then we'll come right straight on top of that with our posterior composite. Posterior composite now then is pushed down inside, and you're able to see some of the flowable composite coming out to the side. One of the advantages that we have found in doing this is that the brown line that you begin to see over time now goes away. And we've got some of these restorations now that are 8 or 10 years old, and we've been doing this technique for that length of time, and you just simply cannot visualize the margins of the restorations years out down the road. And that's been a real positive thing in our practice as we've had the chance to sort of watch some of these kids grow up that we originally used the air abrasion with, and where we developed this technique. So we're contouring that, spending a little bit of time there, getting that pretty close as where we want it, and then we'll come in with an argon laser pack light, and we cure the tooth from the lingual, then we cure the tooth from the buccal, and then we'll cure the tooth from the occlusal. Here we're using high-speed handpiece with copious water to work on that, and when we get through, you'll have restoration that you literally just cannot see the edges of, and it's just a real nice restoration. We use the existing anatomy to guide us a great deal with that, and in a minute you'll see that we use the articulating paper In this instance, we'll use it. We use 2 pieces of articulating paper, so you'll have the patient has a better tendency to close down even on both sides. We found that when we ask them to close down on one side, a lot of times they'd sort of maybe close a little differently. And so what we do now is we ask them to close and go on in and adjust the bite with that after we've got that. And that completes our restoration. Thank you very much for your time.